Hello, this is Dr. Bass. As you know, February is Heart Health Awareness Month, a month where we engage, educate, and energize patients as well as providers alike about the risk of cardiovascular disease. Cardiovascular disease is the #1 killer not only in the United States, but worldwide. There are a host of different risk factors, causes, and other things that impact health in a negative way. In any case, what I wanted to do was to get some of my colleagues, experts so to speak, to talk about specific areas. Well, today is a day like no other. Not only am I bringing to you an expert, but also a friend of mine who has really taken heart failure, that's right, where the heart is failing, and embraced it. Helped patients, and I'm telling you, patients have seen themselves in a way that they've never had. So I want to introduce to some and present to others nurse practitioner Ezebuiro. How are you doing today?
I'm good. How are you, Dr. Bass?
I'm doing well. Now, first off, what made you want to be a nurse practitioner for cardiology?
So I remember as a nurse, when I was doing my rotation, I did a different rotation. I went to every floor and I just couldn't figure out what I wanted to do. So on my final rotation, I went into a cardiology unit and I knew that was it. And I knew that's what I wanted to do. I knew I wanted to go back to school to become an advanced practice nurse because that was just my passion. Just seeing how people giving the patient the power to just take control over their treatment just was something that just was just something that I loved, and that was what made me decide to do cardiology.
Wow. I mean, and I love how you use the word passion, right? You use the word passion, and a lot of times what happens is when you're passionate about something, it's easy to turn that into your purpose. Now, I know you're a mother and you do wonderful, and you know, I've seen you taking your kids out for walks, and they've even chasing me one time at the track, and we had a really good time. But what it showed me was that you don't only talk about it, you live it, right? And I think that's what resonates with many of the patients that see you for heart failure, because heart failure is a very scary diagnosis. When you hear your heart is failing, I mean, patients take that as a death sentence, but I've seen you for many patients turn as a new lease on life. So what is heart failure?
Heart failure is just that your heart is not pumping like it's supposed to. You're unable to just pump the blood to where it needs to go because your heart is a little bit weaker than it should be. It's not a death sentence. It's just that your heart needs a little bit of help to get to where it needs to go.
So now needs a little bit of, now what are some of the causes of heart failure? Because people, I mean, I hear it all the time. I've got a cardiomyopathy this, I've got high blood. What are some causes of heart failure?
So heart failure varies, right? It could be genetics, but that's just like maybe 10% of the time. Most of the time it's uncontrolled blood pressure because you're not taking your medication like you're supposed to and you're not looking at those numbers. Then also coronary heart disease because you have a little bit of plaque in your arteries. We'll also have obesity because you're a little bit overweight and then your heart is working extra hard. That causes it to fail. So it's a combination of different things. Well, those are the main stuff.
And I mean, the things you named are things that some of our colleagues have talked about. Dr. Garza talked about obesity. Dr. Vera now talked about hypertension. I discussed coronary artery disease to some degree. But I know people are wondering, do I have heart? So what are some symptoms of heart failure?
So the classic symptom is just, I am short of breath, right? Mm-hmm. Even getting up to go do basic stuff, or you're just sitting and you seem to not be able to catch your breath. You know, that's like the basic stuff. All of a sudden, my legs are a little bit bigger than they used to be. My shoes don't fit. My socks don't fit anymore. So it's coughing. Sometimes people say, I just cough all day and I'm coughing up some sputum. Mm-hmm. That's another symptoms of heart failure. But mostly it's like, just like we discussed, the swelling, coughing, and feeling short of breath at rest.
I mean, and that's tough because all of those symptoms are things that can be associated with other things. And for many of my patients, and that's why I'm just so happy that you were able to take the time to talk to me today, is I'll get them, I'll tell them the diagnosis, and then I say, I'm gonna turn you over to a friend of mine. And they start off a little scared. I'm not gonna lie, because I've just told them that they have something that is potentially irreversible. But in many cases, you do some magic. I'm not going to say magic. You do some TLC. You really care for them and walk them down that path. So after they've been diagnosed and those type things, what are some things that patients can do to reduce some of the complications of heart failure?
So the whole aspect, the very basics that people don't know is exercise, right? Because for heart failure, it could reverse the disease or even pause the progression of the disease. And that's the basic stuff, like just moving around, because it helps. The heart is a muscle. You have to work the muscle, right? You have to work the heart. And exercising with something very basic. We also have medication to help you. We have a variety of medication. The good thing about heart failure, medication are always being, they're doing a lot of new research. They're coming up with new stuff.
Yeah.
The medication that we have now from when I first started is so diverse. There's so many to pick from. That's what makes cardiology so beautiful, right? You have diverse medication. We see that medication that we're using to treat diabetes is doing great things in cardiology. So there's so much that we have that we can help you with, but we also want you to change your lifestyle.
Okay, talk about that.
Change the way you eat, right? Change your diet, exercise, weight loss. Those things do exceptionally well with heart failure. Because I've seen people that had 10%, right? And we have, they don't have pacemakers, but they feel so good.
Right.
Because they have changed their life, they lost 50 pounds, and they're living their best life. And that's why, we keep talking about all this stuff psychologically, about exercise, lifestyle management, because lifestyle is the number one key to reverse disease.
Right. Yeah, no, and you mentioned, there's a patient that we took care of, and he was not quite on the transplant list, but pretty darn close. And I'm seeing her again, and I'm sick. But before he knew it, 90 days down the road, his squeeze function had gone back up, his vitality was there, and you really reshaped his life by what you did. And so I applaud you. It's an honor to work with you, and I know our patients are better off knowing that they are in your hands. Now, if you had, let's say, 3-4 things to tell patients specifically about heart failure, either to prevent it or how to manage it, what would it be?
You need to know if you have heart failure, right? So early detection. Go into your doctor. Make sure you go to your doctor regularly. Make sure you get your blood pressure checked. Make sure you look for those symptoms to see if you have those symptoms and talk to your doctor about those. Secondly, always when I tell a patient, you can never lose enough weight. Diet, exercise, and weight loss. Because those are the key stuff that prevents you from having any kind of cardiovascular disease, including heart failure. So we want you to change your diet, want you to exercise, weight loss. Those go a long way. And finally, is making sure you're compliant with your treatment. Take your medication as the provider prescribe it. And if you do have concern, you can always discuss it with your provider, but taking your medication and not deferring it, because that could also advance the disease.
Wow. Again, 3 keys, 3 nuggets to certainly build upon. And like I said, it's a pleasure working with you. We are office neighbors. You stay right next door. And I know I bother you when I come over and ask, but it's only because I know that having an extra set of hands to kind of help me lift patients up will make that lift much easier. As I said, I'm Dr. Vatz with the Cardiology Clinic, and I just enjoy talking and working with my providers who are here to make sure that whether it's heart failure, hypertension, diabetes, coronary artery disease, we're working on your behalf to improve your heart health. Thank you.